Hello, and welcome to the Dr. Hayatu Medical Channel. I'm Dr. Hayatu, and it's a privilege to have you with us today. We're going to be talking about a topic that is profoundly important, a health problem that is quietly but rapidly increasing all over the world, affecting communities and families everywhere. That topic is obesity. It's a word we hear often, but I think its true meaning is frequently misunderstood. We need to look past the surface, because obesity is not simply about body size or physical appearance. It is a complex, chronic, and serious medical condition that significantly increases the risk for a host of life-threatening diseases. Understanding the deep and far-reaching health risks associated with obesity is the first, most crucial step we can take. It empowers us to make informed decisions, to seek help when needed, and ultimately, to prevent the long-term, devastating complications that can arise. So, let's start with the basics. What exactly is obesity? Medically speaking, obesity is defined as having an excessive or abnormal accumulation of body fat that presents a risk to your health. Clinically, we often use a tool called the Body Mass Index, or BMI, which is a calculation based on your height and weight. A BMI of 30 or higher is generally classified as obese. But I want to be very clear, this is not just a numbers game. While BMI can be a useful screening tool, it doesn't tell the whole story. It doesn't distinguish between fat and muscle, for instance, or tell us where that fat is stored in the body, which is critically important. What truly matters, beyond any single number on a chart, is the real-world impact this condition has on the intricate workings of the human body. It's about understanding how this excess weight fundamentally changes our biology and sets the stage for disease. That's what we're going to explore today. One of the most significant and well-established health risks of obesity is its powerful connection to type 2 diabetes. To understand this link, we need to talk about a hormone called insulin. Think of insulin as a key. When you eat, your body breaks down carbohydrates into sugar, or glucose, which enters your bloodstream. Insulin's job is to unlock the doors to your cells, allowing this glucose to enter and be used for energy. It's a beautifully precise system that keeps your blood sugar level stable. However, obesity, particularly when there is a lot of fat stored around the abdomen, what we call visceral fat, can throw a wrench in this system. This type of fat is metabolically active. It releases inflammatory substances and fatty acids that interfere with how your cells respond to insulin. Your cells become resistant to insulin's signal. It's as if the locks on the cell doors have become rusty, and the key no longer works as well. This condition is known as insulin resistance. In response to this resistance, your pancreas, the organ that produces insulin, goes into overdrive. It tries to compensate by pumping out more and more insulin to force the glucose into the cells. For a while, this might work. But over time, the pancreas can become exhausted and unable to keep up with the high demand. When that happens, the glucose has nowhere to go. It builds up in your bloodstream, leading to high blood sugar levels. This is the hallmark of type 2 diabetes. And the danger doesn't stop there. Chronically high blood sugar is like a poison to your body. Over years, it can relentlessly damage blood vessels and nerves throughout your system. This damage can lead to a cascade of devastating complications, including heart disease, kidney failure requiring dialysis, nerve damage that can lead to amputations, and even blindness. This is why preventing and managing obesity is a frontline defense against diabetes. The heart is the engine of your body, tirelessly pumping blood, oxygen, and nutrients to every single cell. Obesity places an enormous and direct strain on this vital organ, dramatically increasing the risk of heart disease and stroke. The connection is multifaceted, affecting the heart and blood vessels in several dangerous ways. First, let's consider the plumbing of your circulatory system. Obesity is strongly linked to unhealthy cholesterol levels, specifically higher levels of LDL, the bad cholesterol, and lower levels of HDL, the good cholesterol. This imbalance promotes the buildup of fatty plaques inside your arteries, a process called atherosclerosis. Imagine your blood vessels, which should be smooth and flexible pipes, becoming narrowed and hardened over time. This makes it much harder for blood to flow freely. At the same time, obesity contributes to high blood pressure, or hypertension, which we'll discuss in more detail shortly. This combination of narrowed arteries and high pressure forces your heart to work much harder to circulate blood throughout the body. Furthermore, the excess fat tissue itself, especially that visceral fat we mentioned, is a source of chronic, low-grade inflammation. This inflammation isn't like the acute swelling you see with an injury. It's a constant simmering state of alert within the body that further damages the lining of the blood vessels, making them more susceptible to plaque buildup and blood clots. This inflammatory environment creates a perfect storm for a cardiovascular event. All of these factors, high cholesterol, high blood pressure, and chronic inflammation, converge to dramatically raise the risk of a heart attack or a stroke. A heart attack occurs when blood flow to a part of the heart is blocked, often by a plaque that ruptures and forms a clot. A stroke happens when a blood vessel leading to the brain is either blocked by a clot or bursts. These are medical emergencies that can be fatal or cause permanent disability, and obesity is a major, modifiable risk factor for both. Hypertension, or high blood pressure, is often called the silent killer for a very good reason. It typically has no obvious symptoms, yet it quietly inflicts damage on your body over many years. Obesity is one of the leading causes of hypertension, and the mechanisms are quite direct. Think about it this way: for every extra pound of fat, your body needs to create an expanded network of blood vessels to supply it with oxygen and nutrients. This means your heart has to pump blood through a much larger circulatory system. This increased workload naturally raises the pressure against your artery walls. It's a simple matter of physics. More volume being pushed through a larger system requires more force. Additionally, the hormonal changes associated with obesity play a significant role. Excess fat tissue can disrupt the delicate balance of hormones that regulate fluid and sodium levels in your body, leading to fluid retention and further increasing blood volume and pressure. The danger of uncontrolled hypertension is that it forces your heart to constantly work against high resistance. Over time, this can cause the heart muscle to thicken and enlarge, a condition called left ventricular hypertrophy. A thickened heart muscle becomes less efficient and stiffer, increasing the risk of heart failure, where the heart can no longer pump blood effectively. The constant high pressure also weakens and damages the walls of your arteries throughout your entire body. This widespread damage makes your arteries more prone to atherosclerosis, aneurysm, a dangerous bulge in an artery wall, and rupture. It significantly increases your risk not only for heart attacks and strokes, but also for kidney disease and dementia. Because you can't feel high blood pressure, the only way to know you have it is to get it checked regularly. Managing weight is one of the most effective, non-pharmacological ways to lower blood pressure and mitigate these silent but deadly risks. The impact of obesity extends to the very act of breathing. Carrying significant excess weight, especially around the chest and neck, can physically restrict the movement of the lungs and diaphragm. This means your respiratory muscles have to work harder just to take a normal breath, which can lead to shortness of breath, even with minimal exertion. But one of the most serious respiratory complications linked to obesity is a condition called obstructive sleep apnea, or OSA. Sleep apnea is a disorder where a person's breathing repeatedly stops and starts during sleep. In obstructive sleep apnea, this happens because the muscles in the back of the throat relax, and excess fatty tissue in the neck and throat area collapses the airway, physically blocking it. The person literally stops breathing for seconds, sometimes even up to a minute, until their brain senses the lack of oxygen and sends a panic signal to wake them up just enough to gasp for air and reopen the airway. This cycle can happen hundreds of times a night, even if the person has no memory of it in the morning. The result is severely fragmented, poor quality sleep. Instead of being a restorative period, sleep becomes a nightly struggle for oxygen. This leads to profound daytime sleepiness, difficulty concentrating, and an increased risk of accidents, for example, while driving. But the consequences for the heart are even more alarming. Each time breathing stops, oxygen levels in the blood plummet, and stress hormones like adrenaline surge through the body. This causes a sharp spike in blood pressure and heart rate. Over time, this nightly roller coaster of oxygen deprivation and stress puts an immense strain on the cardiovascular system. It significantly increases the risk of developing hypertension, heart arrhythmias, heart attacks, and strokes. It's a clear example of how one obesity-related condition can directly fuel another, creating a dangerous feedback loop. Our joints, particularly the weight-bearing ones like the knees, hips, and lower back, are marvels of engineering, designed to support our bodies and allow for smooth movement. However, they are not designed to carry a perpetually heavy load. Excess body weight places a tremendous amount of mechanical stress on these joints, day in and day out, with every single step. For example, studies have shown that for every 1 pound of body weight you gain, it puts about 4 pounds of extra pressure on your knees when you walk. This constant, excessive pressure accelerates the wear and tear on the cartilage, the smooth, rubbery tissue that cushions the ends of your bones within a joint. Over time, this cartilage can break down and wear away, leading to a condition called osteoarthritis. This is the most common form of arthritis, and it's characterized by pain, stiffness, and swelling in the affected joints. It's a degenerative process, where the bones can eventually start to rub directly against each other. The pain from osteoarthritis can be debilitating, making it difficult to perform even simple daily activities like walking, climbing stairs, or getting out of a chair. This can create a vicious cycle. Joint pain makes it harder to be physically active, and a lack of activity can lead to further weight gain, which in turn puts even more stress on the joints and worsens the pain. This can lead to a progressive decline in mobility and independence. Beyond the mechanical stress, we are also learning that the inflammatory substances released by fat tissue, which we discussed earlier, can also contribute to joint damage. This systemic inflammation may play a role in degrading cartilage, meaning obesity attacks the joints from 2 different angles, mechanically and biologically. The result is chronic pain that can severely diminish a person's quality of life, and often requires long-term pain management, physical therapy, or even joint replacement surgery. The liver is a powerhouse organ with over 500 vital functions, including filtering toxins from the blood, aiding digestion, and regulating metabolism. One of its key jobs is processing fats. When there is an excess of fat in the body, as is the case with obesity, the liver can become overwhelmed. This leads to fat droplets accumulating inside the liver cells, a condition known as non-alcoholic fatty liver disease, or NAFLD. NAFLD is now the most common chronic liver disorder in the Western world, and its rise has directly paralleled the rise in obesity rates. In its early stages, it's often called simple steatosis, or just a fatty liver. At this point, it usually causes no signs or symptoms, and is often discovered incidentally through an ultrasound or blood test done for other reasons. For many people, the condition may not progress beyond this stage. However, for a significant subset of individuals, the presence of this excess fat can trigger inflammation in the liver. This more serious form of the disease is called non-alcoholic steatohepatitis, or NASH. The hepatitis part of the name means liver inflammation. This chronic inflammation is like a constant injury to the liver, and in response, the liver tries to repair itself by forming scar tissue. This process is called fibrosis. If the underlying cause, the obesity and inflammation, is not addressed, this scarring can become progressively worse. Over years or decades, extensive scar tissue can replace healthy liver tissue, leading to cirrhosis. Cirrhosis is a late-stage, irreversible condition where the liver is so scarred that it can no longer function properly. This can lead to severe complications like liver failure, which may require a liver transplant and a significantly increased risk of developing liver cancer. NAFLD is a silent but potentially deadly consequence of obesity. The link between obesity and cancer is one of the most concerning areas of modern medical research, and the evidence is becoming stronger every year. While we often associate cancer risk with things like smoking or sun exposure, it's now clear that excess body fat is a major contributing factor to the development of several types of cancer. The International Agency for Research on Cancer has identified at least 13 different cancers for which there is sufficient evidence of a causal link with obesity. These cancers include some of the most common types, such as postmenopausal breast cancer, colorectal cancer, and cancers of the endometrium, the lining of the uterus, esophagus, kidney, and pancreas. The list also includes cancers of the gallbladder, liver, stomach, and a type of brain tumor called meningioma, as well as multiple myeloma, which is a cancer of the blood cells. The question is, how does excess fat promote cancer? The mechanisms are complex and still being studied, but several key pathways have been identified. One of the primary drivers is chronic inflammation. As we've discussed, fat tissue, particularly visceral fat, releases inflammatory proteins. This long-term, low-grade inflammation can damage DNA within cells, and this DNA damage can lead to mutations that cause cells to grow and divide uncontrollably, which is really the very definition of cancer. This inflammatory environment essentially creates fertile ground for tumors to develop and thrive. Another key factor involves hormones. Fat cells produce excess amounts of estrogen. After menopause, when the ovaries stop producing this hormone, fat tissue becomes the main source. High levels of estrogen are a known risk factor for breast and endometrial cancers. Furthermore, people with obesity often have higher levels of insulin and a related hormone, called insulin-like growth factor 1, or IGF-1. These hormones can act as signals that promote cell growth and inhibit cell death, which can encourage the development and progression of tumors, including colon and kidney cancer. So far, we have focused on the profound physical toll that obesity takes on the body, but we cannot ignore the equally significant and often devastating impact it has on mental and emotional well-being. The psychological burden of living with obesity is immense and multifaceted, affecting self-esteem, mood, and overall quality of life. In many societies, there is a pervasive and unfair weight bias and stigma associated with larger body sizes. This stigma can manifest in many forms, from subtle teasing and unsolicited advice to overt discrimination in social, educational, and even professional settings. People living with obesity often internalize these negative societal messages, leading to feelings of shame, guilt, and self-blame. This can severely erode self-esteem and body image, creating a constant sense of being judged and not measuring up. This daily emotional struggle is exhausting and can be incredibly isolating. This constant stress and low self-esteem create a fertile ground for mental health conditions. There is a strong, well-documented bidirectional relationship between obesity and depression. The emotional distress from obesity can contribute to the development of depression, while conversely, depression can lead to changes in appetite, motivation for physical activity, and sleep patterns that promote weight gain. It can become a difficult cycle to break, with each condition exacerbating the other. Ultimately, the combination of physical health problems, chronic pain, mobility issues, and the psychological burden of stigma and depression can lead to a significant reduction in a person's overall quality of life. It can limit social engagement, hinder career opportunities, and diminish the simple joys of daily living. It is absolutely crucial that when we talk about treating obesity, we approach it with compassion and address both the physical and the psychological health of the individual as a whole person. After exploring this long list of serious health risks, it would be easy to feel discouraged, but I want to end on a message of hope. Because here is the good news. Obesity is a condition that is both preventable and manageable. While the journey can be challenging, it is absolutely possible to make meaningful changes that can profoundly improve your health and reduce your risk for all the complications we've discussed today. The cornerstone of both prevention and management is lifestyle modification. It's not about extreme diets or impossible workout routines. It's about building sustainable, healthy habits. This starts with what you eat. Focusing on a balanced diet rich in fruits, vegetables, lean proteins, and whole grains, while reducing intake of processed foods, sugary drinks, and unhealthy fats is fundamental. Regular physical activity is also critically important, not just for burning calories, but for improving insulin sensitivity, heart health, and mood. Even small changes like taking a brisk walk each day can make a big difference. And we can't forget the importance of other lifestyle factors, like getting adequate, quality sleep and finding healthy ways to manage stress. In conclusion, I hope it's clear that obesity is not just a cosmetic issue or a matter of willpower. It is a complex and serious medical condition that affects nearly every organ system in the body, from your heart and liver to your joints and your mind. But by understanding the risks, we empower ourselves to act. Early prevention and comprehensive, compassionate management can truly save lives and restore quality of life. If you found this video helpful, please consider sharing it with your family and friends. Awareness is always the first step toward change. Thank you for watching the Dr. Hayatu Medical Channel. Stay healthy and take care of your body. It's the only one you have.